This medication, Olinvyk, is used to treat severe pain. It belongs to a class of drugs known as opioid analgesics. It works in the brain to change how your body feels and responds to pain. It is important to follow the prescribed dosage and take it at the appropriate times to ensure its effectiveness. This medication is given by injection into a vein as directed by your doctor. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than prescribed, because your risk of side effects may increase. Properly stop the medication when so directed. Pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. If nausea occurs, consult your doctor or pharmacist for ways to decrease it, such as lying down for 1 to 2 hours with as little head movement as possible. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have any withdrawal symptoms such as restlessness, mental/mood changes, including anxiety, trouble sleeping, watering eyes, runny nose, nausea, diarrhea, sweating, muscle aches, or sudden changes in behavior. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Use this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Tell your doctor if your pain does not get better or if it gets worse. If you experience nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or headache, it's important to let your doctor or pharmacist know. To prevent constipation, you can try eating dietary fiber, drinking enough water, and exercising, and you may also need to take a laxative. Your pharmacist can help you choose the right one. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of side effects. However, it's still important to be aware of potential serious side effects, such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, fast heartbeat, severe stomach/abdominal pain, or signs of your adrenal glands not working well. If you experience any of these, be sure to contact your doctor immediately. In the case of very serious side effects like slow/shallow breathing, fainting, severe drowsiness/difficulty waking up, or seizures, it's crucial to seek medical help right away. While a very serious allergic reaction to this drug is rare, it's important to be aware of symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any of these, seek medical help immediately. And remember, this is not a complete list of possible side effects, so if you notice any other effects that are not listed, it's important to contact your doctor or pharmacist. To report side effects in the U.S., you can call your doctor or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor or report side effects to Health Canada at 1-866-234-2345. Aliceridine, also known as Olinvyk, is a medication that comes with a risk for abuse and addiction, which can lead to overdose and death. It may also cause severe breathing problems, which could be potentially fatal. To minimize these risks, your doctor should prescribe the smallest effective dose of aliceridine and for the shortest duration possible. It's important to discuss with your doctor or pharmacist whether you should have naloxone available to treat opioid overdose. It's also crucial to educate your family members about the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when starting this medication, after a dose increase, or if the wrong dose/strength is used. Additionally, using aliceridine with alcohol or other drugs that cause drowsiness or breathing problems can lead to serious side effects, including death. It's essential to understand how to use aliceridine and to avoid other drugs that may interact with it. Keep aliceridine in a safe place to prevent theft, misuse, or abuse. If someone accidentally uses or swallows this drug, seek medical help immediately. Women of childbearing age should discuss the risks and benefits of using aliceridine with their doctor before starting the medication. It should only be used during pregnancy when clearly needed, as it may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby. It's important to use the smallest effective dose for the shortest possible time to lessen the risk. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's crucial to notify the doctor if any of these symptoms are observed in the newborn baby. Before using Olinvyk, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Also, it's important to discuss your medical history, especially if you have any brain disorders, breathing problems, gallbladder or liver disease, heart problems, mental/mood disorders, a history of substance use disorder, stomach/intestinal problems, pancreatic disease, or difficulty urinating. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you know how this medication affects you, and to avoid alcoholic beverages. If you use marijuana, be sure to talk to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be an increased sensitivity to the side effects of this drug, such as confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant, this medication should only be used when clearly needed, as it may harm an unborn baby. It is also unknown if this medication passes into breast milk, so be sure to consult with your doctor before breastfeeding. It's important to be aware of potential interactions with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Olinvyk 30 mg per 30 ml, 1 mg per milliliter, PCA intravenous solution opioid analgesics IR include certain pain medications, naltrexone, and samidorphan. Using this medication with other products that may cause drowsiness or breathing problems can increase the risk of serious side effects. Be sure to inform your doctor or pharmacist if you are taking other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. Lastly, be aware that this medication may interfere with certain lab tests, potentially causing false results. Make sure lab personnel and all your doctors know that you use this drug. If someone has taken too much Olinvyk and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to give them naloxone if available and then call 911. If the person is awake and has no symptoms, it is important to call a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an Olinvyk overdose may include slow or shallow breathing, severe drowsiness or dizziness, fast or irregular heartbeat, and fainting. It is important to seek medical help as soon as possible if an overdose is suspected. It is important not to share this medication with others, as it is against the law. This medication has been prescribed specifically for your current condition, and should not be used for any other condition unless directed by your doctor. In that case, a different medication may be necessary. If you are using this medication regularly and you happen to miss a dose, it is important to take it as soon as you remember. However, if it is close to the time for your next dose, it is best to skip the missed dose and continue with your regular schedule. It is crucial not to take a double dose to make up for the missed one. Keep Olinvyk 30 mg per 30 ml, 1 mg per milliliter, PCA intravenous solution opioid analgesics IR, with all antitussive opiates, at room temperature, away from light, and out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.